Welcome to the first installment of the Whiteboard teaching series that I'm going to be doing some talks and discussions on pain, rehab, lifting, and anything around those areas. So today we're going to talk about pain. This is going to be a good foundation for all of the pain and rehab stuff. So a lot of this information is gleaned from my article. It's on my website, which I'll put a link in the description. You can also get to it in my bio on my Instagram at Caleb Retrain Barbell, also on my Facebook bio, just Caleb Pazzi. And the article is how can lifting weights improve pain. So, and then I've also gleaned some of this information from a barbell rehab clinical mentorship that I did. So anyways, so discussing pain. So pain is not as simple as just a mechanical issue where you have like a tissue injury and then it creates a signal. It's definitely part of it, but there's way more to it than that. So it can't be simplified just in mechanical terms and only just in the biological sense. There are a lot of other things that play into pain. Pain, I think a good way to summarize it, it's a dynamic experience and it's unique to every individual. So everybody's going to experience pain differently. So which also helps explain why you can have the same type of injury and people have vastly different experiences and pain severities. It is multifactorial. Just some of the factors that actually play into pain outside of just the physical realm. So you obviously have the physical part, like the actual tissue injury. There's also psychological factors like, anxiety, depression, all sorts of things in those areas. Environmental, which encompasses a whole bunch of plethora of things, just the whole environment the person is living in. Cultural factors, so the way your culture views pain can play into that. Genetic factors, social factors, which some of that is like social learning. So, people propagate like lifting with a rounded back will cause pain. That can influence your pain experience. Your family and how your family views pain and how you learn to view pain through your family's views growing up. Things as like sleep, your stress level, and then catastrophizing is a big one too. So when you get hurt and you start thinking worst case scenario, that's catastrophizing. That can also have a huge influence on your pain experience. And there's many, many others, but that helps kind of give you an idea of at least some of the factors and how there's a lot more to it than just the actual pain source with that. So there are the two good examples I think here that help identify or help explain maybe why you experience pain, especially in the presence of an injury, but also even in the absence of injury. We all have dealt with pain that just shows up out of nowhere. So I think this gives you a good idea of how that can happen and things that can influence why you have pain. So here, if we look here, let's just say your system, your body, your system. We shouldn't say your body because, again, it's more than just the physical body that actually plays into pain, as we discussed. But your whole system has a certain threshold for pain. And all of these factors are going to have certain amounts within that. And if those add up to be above this pain threshold, then that could lead to a pain experience. So it may not be any one thing. It can be several things that are playing into it that push you over this threshold. Now you have a pain experience. So another good analogy is you have a cup, which is just your total capacity for stress and all the factors that play into pain. And if those factors are contained within that cup, then you're probably good. You probably don't have pain or nothing major. But then if those factors add up to be more than what the cup holds, it overflows. Now you pass that threshold. Now you're in a pain experience. So, and then just a few definitions here. So we have nociception, which is the nerve ending, where the nerve endings detect the nerve endings detect and process stimuli that could threaten or cause damage. So they're detecting something that could potentially be an injury or cause damage. So then you have peripheral sensitization, which is where you have an increased sensitivity and a lower threshold at the site of nociception. So let's say you have an injury, let's say like you smash your finger. So you're going to have the nerve endings that are going to detect that damage and send the signal. And when that happens, those nociceptors, they help lower the sensitivity or the threshold of that area. Now it's peripherally sensitized, so those signals start sending up into your spinal cord and into your brain. So then from there we have central sensitization, which are changes in the central nervous system where pain signals are amplified. which can lead to chronic pain and even pain from non-painful stimuli. So once the pain, the signal gets into your central nervous system, which is like your spinal cord, your brain stem, your brain. So that signal can be influenced once it gets into those tracks. So this, I think right here, this is a great way to explain this. So the peripheral sensitization and nociception are like the trigger. So you have something that in the periphery, like in your body, that triggers the pain signal. And then once it gets into your spinal cord, then that can become an amplifier. So it can make that signal stronger for a multitude of reasons. So this is where like chronic pain and where you have painful situations from things that really actually aren't injurious, this is where this can come from. So it can be more, the central sensitization can alter that signal and make it seem way worse than it actually is. So, and from what I've seen, there may be some debate on whether you have to have nociception to actually have pain, like central sensitization. I've seen some research that suggests that yes, there has to be some degree of nociception also, but I've also seen that there doesn't have to be. So whether there does or doesn't, we're still kind of up for debate, I would say. But this is the central sensitization is what can really make pain crazy and very interesting and tricky, because you can have even just a normal signal coming in from the periphery that all of a sudden it gets into the central nervous system and it ramps that up to where it's a pain response. So this is where things like, maybe you've been injured before, let's say deadlifting, you've tweaked your back and you get to where, let's say it rounded a little bit and that's when it happened. You can actually become sensitized to that, to where just the memory of that injury, when you get in that position, that can trigger some of that central sensitization where you can actually get a pain response without actually having anything happen in your back. So pain is just really crazy. It's really interesting, but really crazy too at the same time. So, but yeah, so you have nociception and peripheral sensitization, which is where the trigger of the pain source occurs. But then once it gets in the central nervous system, you have central sensitization, which can amplify that signal and make it not necessarily proportional to the exact signal. So, and some of this can also give you an idea of why, there's a lot of research out there in a lot of situations where people can have rotator cuff tears and not have pain, where maybe they don't have hardly any structural damage on imaging, but they're in a lot of pain and anything in between. So this is, again, why this helps kind of explain that better, because if you look at just a biomedical model, which is basically just biomechanics, so you have a tissue injury and that causes the pain, just a straight one-to-one thing right there. But that we find that doesn't hardly add up at all most of the time. So this gives you more of an idea, because pain has so much more to it than that, to where the structural damage is one part of it, but the pain responses can be a whole different ballgame with that. So when you're dealing with pain and injury and that kind of thing, what are the ways that we can desensitize it, get it to improve and feel better? So the main thing we want to do is calm it down and then build it back up. So we want to first find our tolerable start place of, now lifting is my preferred way to rehab. So with all the lifts like squatting, benching, deadlifting, any of those lifts, especially ones that affect the injured area, we want to find a way we can do those lifts that is tolerable. So it's okay to have some pain, but the pain needs to be tolerable. So once we find that, that's where we start. And then we want to gradually expose and progress from there, gradually increasing range of motion, adding weight to the bar, progressing volume, intensity, all of that kind of, whatever variables we had to modify, we want to progress over time. So we want to find a tolerable start place, gradually progress it and expose it from there. We want to challenge and load the area in a way that's tolerable. So again, if you tweak your knee or tweak your back, you have shoulder pain, whatever, we want to be able to load that area, especially once it's tolerable. We want to challenge it. So that way, once you have an injury or you develop pain in an area, once you figure out you're able to load it and use it, that changes your pain response big time there, because that instills a bunch of confidence. That can start making it feel better instantly, because all of your perceptions and things start to change instantly. So it's very important that once we can tolerate it, we load it and we use it. And we also, through that, we want to violate expectations. So meaning if you think something's going to hurt, if we can get you to load it and move it in a way that you think would hurt, but it actually doesn't, that changes your whole perception, because you have these expectations and we just violated them in a good way. I know that sounds kind of rough, but it's a good thing. We want to violate the expectations by putting you in a position where you can load something and you get a better response than you thought you would. So, and also another big one that's really important with pain and desensitizing it is we want to empower a sense of autonomy, where you feel you have control of your situation so you can do something about it. So a big part of pain is feeling like you don't have control of the situation. So, and catastrophizing, feeling helpless, feeling like you need to rely on somebody to fix you. Those are things that really can affect your pain response and not go well. So that's why I think lifting weights is the best thing for rehab, because if you figure out that you can get under a bar and load yourself and you can actually move your body and do something, actually make it better, you have control over that situation now. And that is immense when we're talking about improving pain and injury. So just to summarize, the best ways to desensitize painful issues or injuries is to find a tolerable start place and gradually load and expose it. We want to try to challenge the pain and the expectations and see if we can violate them in a good way. And then we want to empower our sense of self-autonomy as much as we can. So just for some general guidelines that I think are great operating instructions when you're dealing with pain and injury. If the pain while you're lifting and rehabbing, whatever you're doing with that, as long as it's tolerable, roughly a 5 out of 10 on a pain scale or less, then I think that's acceptable. You can work up to that amount of pain. So rehab and lifting does not need to be pain-free, but it needs to be tolerable for sure. Now, that doesn't mean that we need to make it painful. It just means that if there's pain with a movement, I think we're okay to poke into it up to that tolerable threshold with that. And then also, if you have a rehab session, you lift, the pain's a little more stirred up after that. As long as it settles back down to baseline by the next day, within about 24 hours, I think that's acceptable. We can keep going. That is likely to get better. If it's stirred up for like a day and a half or 2 days, 3 days after, we did too much. And that's where we probably it's probably going to be the volume we need to pull back, but we need to adjust something to make it a little more tolerable with that. So, and then a couple other rules. These aren't 100% because every situation is going to be unique, but these are just general guidelines. If an injury or a pain issue is acute, meaning it just showed up and it's really sensitized, really painful, you're probably going to need to just work around that, kind of load the area around it, kind of protect it a little bit. And then as soon as it's tolerable, then you can start to gradually load it again. Now, if it's chronic, something you've been dealing with for a long time and it's lingering, even if it's pretty painful, we generally want to try to lean into that, load it and challenge it and try to work through that pain more. Because sometimes that chronic pain is a lot more stubborn and we actually need to, that's more that expectation violation we want to do, where we want to try to load it and challenge it. So when it's acute and it just happened, we probably want to work around it. So a good analogy for that is like, let's say you were doing a bunch of shoveling and digging, you developed a massive blister in your hand. So right when that blister happens, that's really sensitive, right? So we don't want to keep putting pressure right on it. We want to just put pressure on the skin around it. Then as that skin starts to heal and gets to where it's tolerable, then we can start kind of putting pressure back on it and gradually load that. We don't want to go crazy. We just want to very gradually load it until it's back to normal, tolerates the stress, that kind of thing. So, so I think this gives you a decent idea of why pain is so crazy and complex, but also, hopefully it kind of gives you an idea of why lifting can be so helpful. And another theme you may be able to glean from this, but this is why we don't really focus on diagnosis, especially in the absence of red flags, like stuff that's an emergency. So, whether you have a rotator cuff tear, a meniscus tear, a bulging disc, a labral tear, all that kind of stuff, you can't just look at that and treat that diagnosis as is and do like specific exercises for that, because the pain response is going to be so different person to person. And just fixing the actual structural issue a lot of times doesn't touch the pain, because there's so many other things that are affecting it. And a lot of times that structural issue may be an incidental finding that wasn't even related to the pain. So that's why a lot of times we don't need imaging, and sometimes imaging makes it worse because then we're chasing something that may not even be the source. So, but that's why when you get hurt, if we can find a tolerable start place and load it and progress it from there and get back into normal training, a lot of times we can get back to normal and be fine, even despite of whatever an imaging may show. So we don't want to treat the diagnosis, we want to treat the situation and the pain itself. Excuse me, not necessarily the pain itself, but the pain situation. We want to work with the pain in the situation. Sorry. You don't want to chase pain and treat that solely, because pain, again, is so complex, you'll end up chasing your tail. So, and that's another reason why I love lifting so much, is because it gives us a plan. So it's like we're going to squat, we're going to bench, we're going to deadlift, power clean, whatever other lifts, and all we got to do is look at each of those movements, make adjustments to accommodate the pain, and then gradually load, progress, expose from there. Usually that's going to take care of most things, especially as long as they're not, red flag stuff or something really nefarious. So hopefully this wasn't too rambly. Hopefully it kind of makes some sense. I'm still learning a lot about pain. I know just in general we all are, but I think this is really important to understand that pain is not a simple thing like that. It's way more complex, but that also doesn't mean it needs to be complex to treat it either. So, yeah, thanks for watching.